Alright, so I have entered the room and I performed proper hand hygiene. Good evening, Mr. Hughes. My name is Daniel Burton and I'm going to be the Jacksonville State Nurse Practitioner student examining you today. Is that okay?
That's fine.
Awesome. So today we're going to be doing an abdominal and a musculoskeletal assessment on you, alright?
Okay.
So we're going to be starting with the abdominal assessment. So unfortunately for this exam, I'm going to have to ask you to remove your shirt, okay?
Alright.
Thank you. And is the temperature okay in here?
It's fine.
Okay. So you can go ahead and lay back. So I'm going to begin the assessment with inspecting the chest, noting for any abnormalities, distension. Everything is symmetrical. The abdomen is flat. Please raise your head. All right, you can relax it. So raising the head allows us to see any maybe some hidden distension or hernias. So now that that's finished, we are going to be moving into auscultation. Okay. So first, I'm going to listen to all four of the bowel quadrants, following the order that the colon goes in. Okay, so bowel sounds are present and active in all quadrants, which is an expected range. So now I'm going to use the bell of the stethoscope to listen to the aortic areas. I'm going to start with the aorta, the renal arteries, and this whole time I'm listening for bruits. Listen to the iliac arteries, and the femoral. It's going to be a little personal, Mr. Hughes. Okay, no bruits noted. So next we're going to move on to the percussion portion of the assessment. I am going to start with your abdomen, okay? I'm going to assess the four quadrants, and we should hear tympani over all areas. All right, tympani heard in all areas. So now we're going to be moving into trying to find the borders of the liver. We're going to start in the area of tympani until we go up to an area of dullness on this right side. Okay, so I'm going to place my first mark here, and it's just right below the sternal border, the costal angle. And I'm going from an area of resonance to dullness now, or resonance to dullness. Okay. And now I'm going to be going to the other side. One more time. Okay, shows an expected range. Okay, now I'm going to be percussing for the spleen. And I should expect dullness. Dullness is heard. So the last thing I'm going to percuss is the epigastric area, and I'm listening for the gastric bubble. It's essentially over the stomach. The gastric bubble is present. So now I'm going to be moving on to palpation of the abdomen. I'm going to start with light palpation and move in small round motions. I'm feeling for masses, any tenderness, Mr. Hughes?
No.
Okay. None noted. So now I'm going to begin with deep palpation. I'm going to start with general palpation of the abdomen, and then I'm going to be moving on to trying to locate the organs. All right. And let me know if you have any tenderness with this. And again, I'm just assessing for masses that might be harder to detect with light palpation. All right, so first, there was no masses. I'm going to be deep palpating around the umbilicus, checking the umbilical ring. There are no masses. Next, I'm going to be moving to the liver. So we already have our marks for the liver to help us faster identify the area. So I'm going to be putting my left hand under you, Mr. Hughes, and with my right hand, I'm going to be pushing up and then turning a little bit to help bring the liver closer to the sternal borders. Okay, the liver is palpable. While I'm here, I'm going to go ahead and feel for the right kidney. I can feel the kidney, smooth, no nodules or masses. I am now going to palpate the spleen. I'm going to reach over him, put my right hand under, and press with my left. The spleen is not palpable, but this is not abnormal. I'm now going to palpate for the left kidney. Left kidney is not palpable, but this is not abnormal. Alright, so I'm going to palpate the biliary duct now, which is just below the liver. It's not palpable, but that's expected. And now I'm going to palpate for the aorta using almost like a pinching. I'm going to go to the left side of the sternal border. Push down. Pulsation is noted. Did you have any abnormal tenderness during any of this, Mr. Hughes?
No.
Alright. So that can, we'll actually sit up real quick, and I'm going to be percussing the kidneys. Okay, will you swing your legs this way so we can face the back and face the camera? Okay. So I'm just going to indirectly percuss the kidneys. Was there any tenderness or pain?
No.
Okay, you can swing back this way. So that concludes the abdominal portion of the assessment. So now we're going to be moving into the musculoskeletal portion of this assessment.
Okay.
During this assessment, we are looking for any asymmetry, muscle wasting, spasticity, redness, swelling, tenderness, crepitus, which is a grinding feeling between two bones. And if you have any tenderness during any of this, we're going to be testing range of motion, strength. If you have any issues or hurting anywhere, please let me know.
All right.
So we're going to start with the wrist, go to the head, and then back down to the legs, okay? So for portions of this assessment, I'm going to ask you to stand up, but for right now, you can remain sitting. So first, stick your hands out for me, or just one hand. For the purpose of this assessment, we're only going to be assessing unilateral because bilateral would take too long. But in a normal clinical setting, we would be assessing bilateral. All right, so please turn your hand up. Okay, so upon inspection, everything seems normal. And expected range, I'm going to now palpate the joints. Any pain or tenderness? No abnormal masses, nodules noted. All right, Mr. Hughes, I'm going to ask you to follow these hand motions for me. While bending at the wrist, bend your hand up. Now down. Okay, close. Make a fist. Touch your pinky to the base of your... Okay, so the patient is not able to touch his thumb to the base of his pinky. All right, so now spread your fingers. All right, move your hand back and forth for me. All right, bend your hand up while I push down. Also, now down while I push up. Great. All right, Mr. Hughes. We're now going to be moving to your elbow, okay? So stick your arm out for me. All right, bend it in. All right, nothing upon inspection seems abnormal, no redness, no swelling. I am now palpating the ulnar surface and the elbow. No nodules, abnormalities felt. Okay, Mr. Hughes. Just one more time, bend your arm in and out for me. All right. Now place that hand on your other hand. Turn out and now back. One more time, out and back. Good deal. Any pain or tenderness? No. Great. So now we're going to be moving on to the shoulder. At this point, can you go ahead and stand up for me, Mr. Hughes? And step over just to the side so the camera can see you better and face the camera directly. I'm going to turn this way just a little bit for this part of the assessment. Okay. Now put your arms out like you're carrying something. Great. Everything seems to be normal. Now I'm going to go ahead and inspect your shoulder and palpate. Is there any tenderness?
No.
No abnormalities felt? No crepitus? No. Okay. So now I'm going to ask you to bring your arm out and then back across. Put your arm up here, behind your back. All right. Bring your arm out like this. Now up, all the way up. All right. Bring it back down a little bit. Now push up, push down. Turn your hand in, push out, push out. Good deal. All right. So shrug your shoulders for me. All right. Good muscle strength. Range of motion is appropriate. If you will turn to the side now, we'll stay forward when we get one more thing. I'm going to be assessing your jaw now, okay? Clench your teeth for me. All right, relax. Open your mouth, side to side, front and back, and then close your mouth. All right. No popping. Is there any tender? Did it hurt any? No. Okay, great. Now turn towards the camera this way, Mr. Hughes. Yep. All right. So now we're going to be assessing the cervical spine. I'm going to ask Mr. Hughes to touch his chin to his chest. Now raise it back up. Now look straight back. Good deal. Put your ear to your shoulder, and now your other shoulder. All right. Push against resistance. Push against resistance. Turn your head. Turn your head. Okay, great. Now we're going to be assessing the spine. Mr. Hughes, will you turn your back towards the camera, please? So we're going to be palpating for tenderness. Do you have any tenderness, Mr. Hughes?
No.
I'm going to go ahead and percuss for tenderness. If you have any, please let me know. All right, so again, we're just doing one side for the purpose of this assessment. Will you bend down, Mr. Hughes? Everything appears to be straight as it should be. It's appropriate range of motion. Go ahead and stand up. Bend back for me. All right, raise back up to the side. Now back to the other side. Okay, great. Now you can turn this way and face the camera again. Go to the side, please. All right, so now we're going to be moving into the hip assessment and the knee assessment. I'm assessing the gluteal folds, making sure his hips are symmetrical. Any tenderness?
No.
Okay. All right, Mr. Hughes. Before I have you sit down, can you go ahead and stand, raise your knee up for me? Okay, bring it down just a little bit, now push back up. Good deal. Now bring it straight back. All right, now bring it forward. Good. Strength is appropriate, equal bilaterally, and I'm assessing his feet as well while he's weight bearing, and everything's appropriate. His arch is appropriate. Everything is in line. Will you sit down for me, Mr. Hughes? All right. And I'm going to bring this out.
Do I need to take my shoes off?
Yeah, I'll take your shoes off in just a moment when we get to the foot portion of the exam. All right, you can go ahead and lay back again. And right now I'm just going to be feeling of the knee to finish the assessment of the knee. No crepitus, there's no swelling. Is there any pain?
No.
No pain noted. Okay. All right. So now, Mr. Hughes, I'm going to be moving into the assessment of your hip, okay? Raise this leg for me. Okay. Bring it back down just a little bit. Now raise it up again. Okay, good deal. Now bend your knee. Great. Bring it back a little bit. Now push again. Okay. Foot flat on the table. Bring your knee in. All right. And bring it back one more time. Bring your knee in. Okay, great. Now push your leg across your leg. There you go. Now push down. All right. Now bring it up and push down one more time. All right. Strength is appropriate. Range of motion is appropriate. Okay, Mr. Hughes, you can roll over on your stomach for me. All right. Raise this leg up. Bring down just a little bit. Bring it up again. All right. And again, strength is appropriate. And from this angle, the hips look to be aligned as well. Please turn back over for me, Mr. Hughes. And take one of your shoes and socks off. I'm going to put this down here for you.
Okay.
You can just throw your sock right there. All right, so we're going to be assessing the feet now. All right, so I'm going to be, just like before, I'm assessing, looking for any redness, swelling. I'm going to be feeling for any tenderness. I'm going to be feeling the ankle joints and all the metatarsal joints. Any tenderness? No swelling noted, no pain. All right, bring your foot back for me. Forward, back one more time. Okay, now plant for me. Come back up. Dip one more time. All right, great. All right, turn your foot in for me. Yeah, there you go. Now turn your foot out for me. All right, flex the toes. There you go, up and now flex. There we go. Bend your toes. There you go. And up one more time. Okay, thank you. You can raise up, Mr. Hughes. All right, thank you for your time. That completes our assessment. Do you have any questions for me?
No.
All right, thank you.